Let me ask you something. When was the last time you woke up with a morning erection? I know, it might sound like a blunt question, but if you're over 60 and those morning signals have quietly disappeared, it's not just part of getting older. It's your body raising a red flag, a quiet warning, and far too many good men ignore it until the damage goes far beyond the bedroom. You see, losing the ability to have strong, natural erections doesn't just affect intimacy. It chips away at confidence. It drains your energy. It can even hint at deeper problems like poor circulation, weakened muscles, and early signs of cardiovascular issues. But here's the part that gives me hope, and I want to pass that hope to you. This is reversible. Yes, even in your 60s, 70s, or beyond. I'm Dr. Moit Kara. I'm a urologist and men's health specialist, and for over 30 years, I've had the privilege of helping thousands of men get their vitality back naturally, not with endless prescriptions or empty promises, but with real science-backed methods tailored to the aging male body. And today, I want to share with you 4 specific exercises that, if done consistently, can help you restore blood flow, strengthen key pelvic muscles, and reignite sexual function, even if it's been years. One of these exercises is so overlooked yet so effective, it often surprises even my most skeptical patients. And I'll walk you through every step, gently, clearly, and with real-world examples. So let's get into it. But before we dive into the first exercise, can I ask a small favor? If you're interested in real, honest advice to improve your health after 60, especially as a man, make sure to hit the subscribe button and tap that notification bell. You never know when the next tip might be the one that changes your life. And if you're watching right now, type 1 in the comments if you've ever felt frustrated about your sexual health, or 0 if it's not something you worry about. Either way, I appreciate your honesty and your courage. 1. Pelvic floor activation, the silent power behind stronger erections. Let's begin with the foundation. If you only remember one thing from this video, let it be this. Your pelvic floor muscles are your body's natural control center for erections. I'll tell you a story about a gentleman named Richard. He was 67, a retired school principal, married for over 40 years. He came into my office looking defeated. He wouldn't make eye contact. And after a few moments of silence, he finally said, "Doc, I still love my wife, but I don't feel like a man anymore." That broke my heart. He had gradually lost his ability to maintain an erection. Pills helped a bit at first, then stopped working. But what changed everything for Richard wasn't some miracle drug. It was a daily routine I gave him that he could do at home, in his chair, in less than 10 minutes. Just 8 weeks later, he walked back into my office, smiling. "Doctor," he said, "I feel alive again." That routine? Pelvic floor activation. You might have heard of it as Kegels for men. Most people think Kegels are just for women, or maybe for bladder control. But for men, especially over 60, it's one of the most powerful, underutilized tools for improving sexual health. Why does it work so well? Because the pelvic floor muscles help trap blood in the penis during an erection. Think of them like a clamp. When those muscles are strong, they keep blood right where it needs to be, inside the erectile chambers, so the penis stays firm. But when those muscles weaken with age, and they do, blood escapes too quickly. That's when you get soft erections, or ones that fade too soon. Here's how you can start training those muscles today. Step-by-step guide to pelvic floor. Activation. Find a quiet space. You can sit or lie down, whatever is comfortable. Identify the muscle. The easiest way is to imagine you're urinating and then try to stop midstream. That squeeze you feel? That's your pelvic floor. Be careful. You shouldn't feel your abs, legs, or butt tightening. If you do, you're tensing the wrong muscles. Start simple. Contract the pelvic muscle gently and hold for 5 seconds. Then release and rest for 5 seconds. Do 10 repetitions. That's 1 set. Try to do 3 sets a day. Morning, afternoon, and evening. Build gradually. After 2 weeks, start holding the squeeze for 7 seconds. Then 10 seconds. Increase reps as you get stronger. No gym, no equipment, just you and a few minutes of focus. Within 4 to 6 weeks, many of my patients report stronger erections, better endurance, and even more control during sex. And here's the bonus. It builds confidence. Because instead of hoping your body will work, you're actively taking steps to make it work. That's something no pill can give you. 2. Diaphragmatic breathing plus pelvic flow mobilization, resetting the nervous system for intimacy. Let's shift from muscles to breath. Yes, breathing. Because this next technique taps into your nervous system and your body's natural state of relaxation. Now I know breathing exercises don't sound very sexy, but trust me, they can make a world of difference. Let me tell you about John. He was 72, still working part-time, active, and sharp. But when it came to intimacy, he told me, "Doc, I just can't be present. I want to connect with my wife, but my mind races, and my body just doesn't respond." What John didn't realize is that he was stuck in fight-or-flight mode, a constant state of low-level stress. You know that feeling, where your shoulders are tense, breathing is shallow, and your thoughts just don't slow down? In that state, your body literally shuts off blood flow to the pelvis. It's your biology protecting you from danger, but in the wrong context. This is where diaphragmatic breathing comes in. Also called deep belly breathing, it activates the parasympathetic nervous system, your rest and digest mode. That's when blood flow returns to your pelvic organs, your heart rate slows, and your body becomes ready for intimacy again. Here's how to do it. Sit or lie down in a quiet space. Get comfortable. Place one hand on your chest, the other on your belly. Breathe in slowly through your nose for 4 seconds. Feel your belly rise, not your chest. Hold the breath gently for 2 seconds. Exhale through your mouth for 6 seconds, feeling your belly fall. That's one breath. Repeat this cycle for 5 to 10 minutes. The goal is to shift your body's rhythm, reduce cortisol, your stress hormone, and open up your blood vessels, especially the ones that matter most for erections. I recommend doing this twice a day, once in the morning, once in the evening, and especially right before intimacy. I've had couples tell me they started breathing together before bed, and it rekindled not just physical intimacy but emotional connection. Over time, as your breathing deepens, your body relaxes more easily. Erections become more natural, not forced, not pressured, just part of a healthy, flowing system. And that, my friend, is where real sexual health begins. 3. Rebuilding confidence, one step at a time. 2 months later, that same man walked into my office standing taller, smiling more easily, and said, "Doc, I haven't felt this confident in years." And it wasn't just about his erections. It was about how he carried himself. His mood lifted. His relationship improved. He started exercising more. That little plastic device became a turning point in his health and mindset. Now let me explain exactly what this vacuum pump is and how it works, without all the jargon or intimidation. A vacuum erection device, or VED, is a simple tool that creates a gentle vacuum around the penis, pulling blood into the erectile tissue. Once the blood is in, you place a snug ring at the base of the penis to keep the blood there during intimacy. No, it's not painful. It's not awkward once you get used to it. In fact, many men describe it as strangely satisfying, the feeling of encouraging your body to do what it once did naturally. The most important part? You're retraining the body to circulate blood to the area again. Over time, that improved circulation starts to happen on its own. Here's how to use it properly and safely. Always begin by applying a water-based lubricant to the rim of the cylinder to create a seal. Place the cylinder over the penis, ensuring it's centered comfortably. Use the pump slowly, whether manual or battery-powered, to create suction. You'll see the penis gradually become engorged. Don't rush. Allow the blood to fill the chambers fully. Once you're at full erection, slide the constriction ring to the base of the penis and remove the cylinder. You can maintain the erection for intercourse for up to 30 minutes safely. Just be sure to remove the ring after that. I recommend using the pump once a day, even if you're not planning to be sexually active that day. It's like physical therapy for your reproductive system. Think of it as a workout, not just for pleasure, but for healing. The benefits go beyond sex. Improved blood flow helps nourish tissues, boost oxygen supply, and prevent long-term atrophy of the penile tissue, especially important if you've been dealing with dysfunction for a while. For many men, this simple routine brings back not only erections, but a sense of hope. And that hope? That's powerful medicine. 4. Glute bridge with pelvic activation, the unsung hero. Now, let's talk about one of the most overlooked but transformative exercises for older men. Glute bridge with pelvic activation. This one doesn't get nearly the attention it deserves, but let me tell you, it's a game changer. You see, the glutes, your buttocks, are some of the strongest muscles in your body, or at least they should be. As we age and sit more, they become dormant. Weak glutes mean less support for your hips, lower back, and, yes, the pelvic floor. When you strengthen the glutes in combination with your pelvic muscles, you're reinforcing the entire support system around your reproductive organs. This results in improved control, stronger contractions during orgasm, and better erections. It's like reinforcing the foundation of a house. I remember working with a retired firefighter named Joe. He was in his early 70s and had always been strong, but years of inactivity after retirement had weakened his core. He told me, "I still feel young in my mind, but my body just doesn't listen anymore." We started him on this exact glute bridge routine, and within a month, he was not only performing better sexually, he was moving better, feeling stronger, and had way less back pain. "Doc," he told me, "I feel like I've rewound the clock. Here's how you do the glute bridge with pelvic activation. Lie on your back on a mat or soft surface. Bend your knees, feet flat on the ground about hip-width apart. Keep your arms relaxed at your sides. Now, slowly lift your hips off the floor by squeezing your glutes and engaging your pelvic muscles. Yes, those same ones you worked on with the Kegels. Hold the bridge at the top for about 5 seconds, keeping your core tight and your pelvis stable. Lower your hips slowly back down to the floor. Start with 10 repetitions. Rest for a minute. Do 2 to 3 sets a day. As you get stronger, hold the bridge position for longer, up to 10 seconds. You'll feel your glutes and lower abdomen working together. That coordination is key to regaining control and power where it matters. Not only will this help your sexual function, it will also improve your posture, stability, and overall lower body strength, which, let's be honest, is something we all need as we age. Now that you've learned these 4 exercises, Kegels, diaphragmatic breathing, vacuum therapy, and the glute bridge, I want to share something important. Don't treat them like separate tricks. They work best when combined into a daily routine. Think of it like this. The breathing prepares your nervous system. The Kegels strengthen your control. The vacuum therapy trains your circulation. And the glute bridge reinforces your entire support structure. Used together, they form a complete system that addresses the root causes of erectile dysfunction, not just the symptoms. Start small. Morning, Kegels plus 5 minutes of deep breathing. Afternoon, glute bridge set. Evening, vacuum pump plus short breathwork session. Stick with it for 4 to 6 weeks. Take note of how your body feels. Track your progress. And please, talk with your partner. Let them know what you're doing and why. Intimacy is about connection, and this journey is worth sharing. If you're over 60 and struggling with your sexual function, let me say something directly from the heart. You're not broken. You haven't lost your manhood. What's happening to your body is a natural response to aging, stress, inactivity, and sometimes health conditions. But just because it's natural doesn't mean you're stuck with it. You can rebuild. You can feel strong, confident, and connected again. And you don't have to do it alone. I've helped thousands of men go through this journey, and I believe in your ability to take back control, naturally, safely, and with dignity. Now I want to hear from you. What's the one thing from today's video you're going to try first? Have you ever heard of these techniques before? Or tried them? Please share your thoughts in the comments below. Your story could inspire someone else. And if this video helped you in any way, if it gave you hope, clarity, or motivation, please give it a thumbs up, leave a comment, and subscribe to our channel Natural Health Secret. Your support helps us reach more men like you and bring life-changing health advice to those who need it most.